everyone, greetings of the day. I'm Pooja from the All About Skin Wellbeing team, welcoming all of y'all to talk a lot about skin and skincare. I'm hoping all of y'all are keeping in good health, and we would really like to discuss a lot about how you can take care of your skin, especially being a very important subject, more and beyond your appearance. It is one of the largest organs in our body, and our skin becomes the most essential one in our overall health and well being. A fungal infection is very common on your skin and nails. Fungal infections or mycosis are diseases that are caused by a fungus, which is a yeast or a mold. Mild fungal skin infections can look like a rash, can be itchy or annoying. I don't know if you've ever experienced this, but this is the topic that we're going to be talking about a lot in detail today. So let's connect today with our skin expert, Dr. Deepa Krishnamurthy, who's live with us from Bangalore. She's here to enlighten us on the topic of fungal infections. Dr. Deepa Krishnamurthy is DDVL, which is Diploma in Dermatology, Venerology, and Leprosy. DNB Dermatology, MBBS, Consultant Dermatologist. Dr. Deepa Krishnamurthy is a renowned consultant dermatologist with a noteworthy 14 years of experience. Her impressive credentials include a DDVL, a DNB, and an MBBS degree, which is attested to her in-depth knowledge. Dr. Krishnamurthy is a highly experienced doctor in the field of dermatology, as well as with her wealth of experience and her education, she brings to us a lot more insight for today. Hello, Dr. Krishnamurthy. Welcome to our show, and let's start this show about fungal infections.
Thank you so much for the introduction.
So, Doctor, we really wanted to know a little more about how we can take care of our skin, especially with fungal infections rising these days, and how can we really tackle them?
See, fungal infections are something which we commonly see in our day-to-day practice. I think most of us would have gone through some kind of fungal infection some time or the other. So when it comes to fungal infections, prevention is the main thing which is more important than the treatment. So preventing infections before you go for the treatment is something which will help. So when it comes to fungals, it basically thrives on moist environments, especially wherever there is sweat accumulation, like in the folds. So taking care of these sweat-based areas like the folds, keeping the area clean and dry is something which is a very important step in preventing fungal infections. Like when you have fungal infections in the groin or the armpits or below your breast or any folds in that case, if you sweated a lot, try to wash that area or take bath once in the evening and pat it dry completely with a tissue paper so that there is no wetness. So fungal infections can infect any area like skin, it can infect your hair, it can infect nails as well, and also between your toes. Also, there can be moisture accumulation and cause fungal infections. So the first step is to keeping the area dry. Second is wear loose, breathable clothing as such. Anything made of cotton is something which will help with the absorption of the moisture and preventing further infections as such. And whatever clothing you're wearing should be put in, to wash. It should not be re-worn without washing because the fungal spore stays behind in the clothes. So you will have to wash them so that the fungal spores are eliminated and that can be taken care of. The third most important thing is practicing a good hygiene, like wash regularly, take bath regularly. Second is if you have any fungal infection in between your feet, like through the day, since you sweat a lot, you wear shoes and other things, you have to wash your feet and pat it dry between your toes. And it also spreads through contact. So you avoid sharing of your towels or your razors or your clothes with others also. So that is also one more thing which you need to follow. And good hydration as well as the diet plays a major role in improving your immunity against the fungus. So these are a few important things which you need to look at before you develop a fungal infection. Prevention is something which is important.
Absolutely, Doctor. I think thank you very much for highlighting the importance of hygiene and how basic things can really help us prevent fungal infections overall. But, Doctor, imagine if somebody is actually fought or got with fungal infection. So, what is the treatment like?
So when you have a fungal infection, as I told, that it can infect your skin, hair, or nail as such. Particularly coming to the skin infections, which is very common as such. So primary thing is, if you can't, you can use antifungal powders or something to keep the areas dry. That will also prevent fungal infections. Second is, you have to use certain antifungal creams. So there are different types of antifungal creams. If it is a very mild infection, creams are sufficient. But if the infection is further down, where there is a lot of burning sensation, itching or flaking, or it is involving a lot of other areas of your body instead of just one particular area, then you will have to definitely meet a dermatologist and start with the antifungal medications. Also here prevention also plays a role. Also taking care of your hygiene plays a major role, because it is not just you but also your contacts which who can spread the infection as such. So all the clothes, again, whichever you've worn, all those should be washed separately. Towels also shouldn't be shared. All the clothing, bedding, everything should be. Isolation is something which will help in preventing the infection from you to others. So primarily it's antifungal creams and antifungal tablets, but that
Okay.
you better is to consult a dermatologist and go ahead and follow the hygiene. This should help in treating the fungal infections.
Okay. So, doctor, you spoke about antifungal tablets. So, does it mean that we have antibiotics also that have been used to treat fungal infections?
No, antibiotics we don't use to treat fungal infections. In fact, antibiotics can increase the fungal infections, especially like vaginal candidiasis, which is also a fungal infection which is caused by candida. Here what happens is this: when you give an antibiotic for a little longer duration of time, it so
Mhm.
this candida is basically a normal fungi which is present in your vaginal secretions or on your skin. So there is a
Okay.
balance in the normal bacteria and the normal fungus which is present. But when you give antibiotics, there is an imbalance of this which happens. So because of
Okay.
which there is an overgrowth of the fungus, and the normal bacteria which controls this growth becomes suppressed, and that leads to, in fact, more fungal infections. So antibacterials are not primarily recommended for fungal infections. It's primarily
Okay.
the antifungal medication.
Okay. So clearly, viewers, please make a note. There's a difference between antifungals and antibiotics. Please do not go up and choose any medicines until you've been prescribed for. Doctor, we've known there are a lot of different types of fungal infections. So, which is the most serious form of fungal infection, if you can highlight, please?
So when it comes to fungal infection, when it involves your superficial structures, as I was telling, skin, hair, and nail, these are not very serious, but these can become, secondarily infected. Complications can happen, like when it can involve extensive areas, then they can get superimposed with secondary bacterial infections. So that can lead to a little serious variant. But otherwise, more of systemic fungal infections are something which we consider it as a serious variant, where we will have to go with sometimes IV antifungals, and it can involve other organs as well affecting your health. But when it comes to skin or the hair or the nail, this can be under control, or it can be treated very easily if you follow all the precautions and everything as such. I can't hear you. I've lost.
So, doctor, we've heard that fungal infections obviously can be treated, but what about fungal infections that are recurring? Why do you think fungal infections recur?
See, fungal infection, recurrence of fungal infections is something which we generally commonly see, because a lot of people come to us telling that I've been having a fungal infection from so many years. It has not been, gone any time as such. So the main reasons for that is, one is you're not taking a complete treatment. See, fungal infections have to be treated until it completely disappears. So say your symptoms reduce, like your itching reduces or your redness reduces or your patch reduces, most of the people tend to stop the treatment. So when you stop the treatment, the fungus is not completely eliminated from your skin. So what happens is it slowly starts multiplying, and then after few days or few months, again you end up with a patch again. So proper treatment is one of the main thing which will help in preventing the fungal infections. Second is your immunity. Sometimes some people may be taking, like as I was telling you, antibiotics also suppresses the immunity. Or if you're a diabetic, where again high sugars also increases fungal infections. Or you're on certain medications which suppresses your immunity, like certain immunosuppressants, that can also cause the infections to keep recurring again and again. And the third important thing is, you're treating yourself but you're not treating your family members. Like you are, if whoever is there in the family, if they also have an infection, and again the source is there, so say it is be in the clothes or be it in the bed sheets or the places where you sit, so there are fungal spores which are present in all these areas, which can make it to reoccur again and again. So treat all the family members and take a proper complete treatment. Also, what happens is, sometimes when you have taken treatment, you have taken it for a few days, then you stop it, and then again, because it comes, you take it for some time, you're not completing the course of treatment. What happens is, there is something called as a drug resistance which happens. So in this drug resistance, it's that the fungus what you is there on your skin becomes resistant to the drug which you have been taking again and again. So when you're not taking a complete course of the antifungal medicines, it can lead to drug resistance, because of which we have to go for different types of antifungal medication, which we will have to just try it out, because we will not know which you are resistant to. So that is why it is very important to complete the whole course of the treatment with fungal infections.
Right, doctor. So I think you answered my next question as well, which was like, do we stop taking medication when we start feeling that our skin infection subsided? So clearly, as you mentioned, that we can't stop the medication immediately. We need to consult the doctor when is the actual right time to complete and then get rid of fungal infection. So thank you, doctor. Doctor, I had a question specifically for my female viewers who are pregnant. Are antifungal medications okay and safe to be consumed during pregnancy?
So during pregnancy, we generally don't prefer giving oral medications. If it is just a small patches that the patients are having, then antifungal creams are something which we prefer to give, because they are something safe and don't get absorbed much into the circulation. So antifungal creams is the most preferred mode of treatment. But again, if they have an extensive fungal infections, because during pregnancy, again, there can be extensive fungal infections, and if not treated during pregnancy, then after delivery, there is a chance that the fungal infections can spread to the baby as well. So we primarily treat them with certain antifungal tablets like terbinafine, which is a category B drug. Category B means where the benefits outweigh the risk as such. So that can be given during the pregnancy, which will help in suppressing the spread of the fungal infections, so that it doesn't, like, it completely clears out, and the mother doesn't transmit the fungal infection to the baby as such. But creams is something which can be safely used if it is a mild fungal infection. But if it is spread further, it is better to be treated now rather than during lactation, because during lactation, again, breastfeeding, we don't prefer to give any oral medications. At least during pregnancy, we can give certain medications which can help. So treat it before delivery is always better.
Okay. Right. Thank you, doctor. So, doctor, what about antifungal medications being consumed for very long? Are they having any side effects, any issues with that?
So all antifungal medications are something which are metabolized in the liver and eliminated in the kidney, right? So what happens when you take antifungal medications for a longer time? If it is a normal, healthy adult, generally there is nothing that we worry about as such. But in people with polypharmacy, like they are on multiple medications for multiple concerns as such. So we do have certain interactions with the medications, like certain say your cardiac medicines doesn't go along with the antifungal medicine, so we will have to evaluate which is the safer medicine to be given, and based on that we give it. Otherwise also, since it is eliminated through the liver or metabolized in the liver, so liver function test is something that we monitor, so that is not affecting any other liver enzymes or any liver issues come up as such. So that is something that we primarily look at when we are giving an antifungal medication for a longer duration of time. 1 2 months is still fine, but when people are not having a normal liver parameters, we need to evaluate it, rather monitor it as well, so that we are not having any other issues with it.
Right.
But
So,
creams
doctor,
are
you
something,
also go on. Sir.
so creams are something which we give for long duration without any side effects as such. Creams can be used on a regular basis, but when we are giving antifungal tablets, especially the tablets which we give for nail infections we give for a long duration of time and a little higher dose of antifungal medicines. So that time we do consider getting a liver function test done before starting off with the medicines.
Okay. So, doctor, you just mentioned about the toenail specifically, and we've heard a lot of toenail infections. So, any sort of precautionary measures that our viewers can probably take for avoiding infections?
See, toenail fungal infections, one is that most commonly what we see is if they are involved in waterworks, like, the housewives who are, most of the time in water, their hands are always soaked, or they're using the detergents, dishwashers, and all those things. So what happens is that the nail bed, so the cuticle we call it, the the skin between your nail and your skin, normal skin, is something which gets, there's a gap which forms, which leads to the fungus to enter into your nail bed, and it causes a fungal infection. This is something which we commonly see in housewives who work with water, that is with hand, this one. Even toes also, we do see fungal infections of the toes. Also, in people who have a low immunity, chances of fungal infections of the nails is very common. So when we have fungal infections of the nail, we do have topical medications. If it is a very mild fungal infection of the nail, topical medications are sufficient. Again, creams doesn't help for nails. We go with something called as a lacquer based, which has an antifungal medication in it. It creates a kind of pores into, because nothing penetrates into the nail per se. So the medicine needs to get into your nail bed rather than on the nail per se. So what happens is that nail lacquer creates a pores which helps in the medicine to enter inside. But if it is multiple nail involvement and it is not improving with the nail lacquers, then we go for oral medications. Say if it is for your fingernails, we do give like for pulse doses, like 1 week in a month, or everyday tablets also we do give. So that will be for at least 2 to 3 months. But for the toenails, we will have to prolong it further because the nail growth is delayed because of the fungal infections. Normally, 2 months is sufficient for
Okay.
the nails, and 3 to 4 months for your toenails as such. So
Okay.
the only precaution is handling water, which is something which you need to take care of. So wear gloves in case you have to wash vessels, or clothes, anything. Contact with water is something that you need to take care. Or you finish all your work and then wipe it dry completely so that there is no water accumulation onto your nails as such. So prevention again plays a major role with fungal infections, be it nails or skin or hair.
Great. So, yeah, clearly preventing a lot. And I understand there are times when we can't prevent certain conditions as well. Like, I have my house help who needs to be in water with her feet as well, and which is where she gets these fungal infections every year, especially during monsoon. So, yeah, we look at different forms of treatment, and sometimes prevention is just difficult, but please do make sure that you're taking all your care. Doctor, there's one question come into our chat window from Mr. Firoz Khan. He has a question that can fungal infections affect the lungs? Your take on it, doctor.
Absolutely. Fungal infection can affect the lungs as well. As I was telling you, there is something called as a systemic fungal infections, where it not just the skin, hair, and the nail, also it can get into your blood, where it can, affect your lungs, and that can cause, the organ damage as such. So that is a serious form of fungal infections, which requires, admission and IV antifungal medications and other things as such.
Okay. Doctor, another question also, which is can a fungal infection recur even after completing the entire treatment prescribed?
See, recurrences, there are different types of recurrences. So, generally, what happens is, as I was telling you, if you have not taken the complete course of treatment, that is when we do see the recurrences.
Mm-hmm.
The Otherwise, it's more of a reinfection. Like, see, certain people have a very low fungal immunity. Immunity against the fungus is low. So, they tend to keep developing this fungal infections often. So that is
Yeah.
more of a genetically predetermined thing which we cannot predict as such. So reinfections are very common. Recurrences happen only when it is not completely treated. When
Yeah.
complete treatment is not taken, see, if you presume that we give a course of like 1 month or 2 months like that, like a course, but 1 month and 2 months may not be sufficient. For us, the end point is to see and determine whether the patch has completely disappeared or not. Their patch may not disappear completely also sometimes because the pigmentation stays behind, but I think a dermatologist can find out because we do see the borders. The borders kind of blends with the skin. That is when we decide, okay, this is kind of treated as such. So till then you have to take the treatment. That is important. Third is immunity. So people who are diabetics or people who are on immunosuppressants or on certain immunosuppressed people, all these people have chances of recurrences because their immunity to fight against the fungus is less. See, fungus is present in and around us abundantly. It is just that how much our body is able to fight against the fungus, which will help us in preventing these fungal infections.
Doctor, I had a personal question. I read about fungal infections a while back, and I also read that fungal infections can be cancerous as well if they're not treated at one point in time. So, what's your take? When do we really take fungal infections extremely serious, and are there any blood tests to be done to understand about this?
See, fungal infections turning into cancer is mostly systemic as such. So, on the skin, most the fungal infections don't turn into any cancer or anything. See, when it comes to systemic fungal infections, it does have a major role to play because it affects multiple organs as such. So, the
Mm-hmm.
ability of this organ to function normally is not happening. So, since all our organ systems are interdependent as such, so it has to function normally. So, any one organ gets affected, it can affect multiple things as such. So that is something that systemic fungal infections are something which needs to be considered as a very serious infection and need to be treated accordingly.
Okay. Doctor, I also read about warts. Do warts have any connection with fungal infections?
No, warts are basically viral infections. So they are caused by human papillomavirus, we call it. So they are something. So warts are something which can turn into cancers. That is, turn into cancers. Rather, I would say there are certain subtypes of human papillomavirus which can cause CS cervix as such. That is why we give this vaccination. I think everyone would have heard about the HPV vaccine, which is advised for all children as well as the reproductive age group. So this is to prevent against CA cervix, which has certain HPV subtypes which are cancerous. But the common warts which we see on the skin, the chances of it turning into cancer is not much, but that also needs to be treated because they can spread, they can increase, they can spread to others. So that also needs to be treated.
Okay. Great, doctor. Doctor, another common question that's been coming up from our viewers is whether ringworms can be treated, especially during the feet areas. Is there something that we can do about it?
See, ringworms are nothing but the same fungal infections as such. So, in the feet, so when it comes to feet, few things you need to take into consideration is because they're all the time, there if it depends upon how your feet is. If there is not much of a gap between your toes, then what happens is that there is not proper uh, or the circulation, air circulation is not happening. So
Yeah.
because of which there is moistness which is present between your toes, which is like a breeding ground for fungus. So it's like a
Yeah.
sweat, like a food for fungus. You're growing more fungus when you have the
Yeah.
sweating. So moisture is something that we will have to take care of. So
Mhm.
if wear some open toed, if you have a fungal infection, wear open sandals. That is the best thing. But
Mhm.
otherwise, also if you're wearing shoes or anything like that, wear cotton socks where your sweat is absorbed. And as soon as you remove your shoes, wash your feet thoroughly with soap and water, and then pat it dry between your toes. After
Okay.
bath, after using the washroom, pat uh, the toes between your toes because wetness in any form can cause fungal infections between your toes. We call this as athlete's foot as such, and it is very difficult to eliminate it unless and until you take proper precautions as such because our treatment it will help, but prevention is something that will help in faster recovery as such. and prevent recurrences, in fact.
Clearly, doctor. So obviously, prevention is the key. Keeping ourselves hygienic, keeping yourself dry, I think, is such an important thing that we're getting to learn. And people who are not practicing all of that, please go ahead and practice it. We're waiting for some more questions to come in from our viewers. While I would like to again raise one more question, doctor. It's very exhaustive for anyone to continue with the fungal infection treatment. At times, it goes up to 6 months also. Is there a time frame that how long should really a person have a fungal medicine, an antifungal medicine?
See, the time frame is basically based on how the person has responded. So, as I was telling before, until the patch completely, the borders completely disappear, that is, till then we have to treat it. Minimum is generally 1 2 months, depending on how extensive is the fungal infection. If they are just in one particular area, 2 to 3 months maximum, it completely clears out. But when it is extensive, as you told, it will take at least 4 to 6 months as such for it to completely clear out. And you need to take it, because otherwise you'll end up taking much more longer courses in breaks as such, where you are not even treated and you're going through the suffering again. So better to take it at one stretch rather than taking multiple courses at different points of time.
Yes. Right, sir, doctor. So, viewers, please be careful to complete your treatment. Don't decide to stop the medication at your own will. Please do reach out to your doctors. Doctor, we have some follow up questions in the chat window. They're saying, are fungal infections more common in any particular regions? This is a question from Pooja Sharma.
Yes, fungal infections generally are more common in folds. Wherever there is a sweat accumulation, those are the areas where we see most commonly the fungal infections. So, as I told, underarms is one thing. Uh, below your breast, wherever the skin folds are happening along the waistline, groin area, all these areas the sweat accumulates. So since it is moist in those areas, that is where the fungus grows. That is when we do see these kind of fungal infections very commonly in these areas.
Clearly. So I think the weight also has got to do with fungal infection. Not increasing your weight also will help you reduce the folds. So work on your body as you work on your fungal infection as well. Doctor, another question from Dave. He says, what antifungal medications are commonly prescribed?
So antifungal medications, we have topical antifungals and systemic antifungals. Topicals are something like creams which we give for application. So in creams, we do have like terbinafine based creams, azole based creams we call it. There is ibuprofen, sertaconazole. So there are different azole based creams, cyclopyrox based creams. So these amorolfine based creams, these are the creams are given only when there is if it is only in certain areas, then only creams we give. But if it is extensive area, we go for systemic medications, systemic medicines, systemic antifungals. The three main things which we depend upon is itaconazole, then terbinafine and griseofulvin. So now most commonly we give itaconazole or terbinafine, griseofulvin also, because of the drug resistance we are seeing quite often nowadays. So we do mix and match all these three things, because they can increase the help in treating the fungal infections further where there is a drug resistance.
Okay. All right. So, Dev, I hope we've answered your question. But even after knowing all the antifungal medications, please do not have them yourself. Go and reach out to your doctor and follow the prescription clearly. Doctor, another question coming from Kilan Singh. The question is, what are the long-term effects of untreated fungal infections?
So when we don't treat fungal infections for a long duration of time, one is it does spread. It spreads to different areas of your body. You can get complications because of the fungal infections, like there can be secondary bacterial infections. So there can be wounds which form, blisters which can form, or there can be pus coming out of these fungal infections. Third is it can spread from you to others also, like just not you, but you will be spreading it to other family members or your friends or your colleagues as such, because the load of fungus is high when you have an extensive fungal infection. So you will be spreading it easily. Other than that, there can be like the skin keeps getting thickened. So even if you treat a fungal infection, after that also the after effects stays, like the skin is not completely back to normal, right? Like it will be still black in color and the skin can be thickened. So the after effects are more with untreated fungal infections. It can also lead to systemic infections if you're not treating it properly as such.
Okay. So clearly, let's not leave it untreated. The first sign of an infection that you think is fungal infection, also please go and reach out to your doctor. Another question, Doctor Sana Sharma. I think she's joined in late, which is why she's asked the question, which we've already answered. Can a fungal infection recur after treatment? Maybe if you want to just highlight it once again for her, in case she's not heard the information before.
So again, fungal infections can recur because of improper treatment, like not taking the complete course of treatment. Improper, if your immunity is low, that also can cause recurrence of infections. Because you have not taken a proper treatment, there can be drug resistance, which can also cause recurrences of the fungal infections. And also not treating your family members or your friends who are staying with you, who are having a fungal infection, thereby causing a recurrence.
Great. Thank you so much, Doctor, for highlighting it once again for our viewers. Any more questions coming in from our viewers? We'd really like to address all of them. I personally feel, Doctor, that we've addressed a lot about fungal infection, right from staying hygienic, and also about clothes, like as basic as that, like not sharing our clothes with each other, keeping it clean. Your towels to everything needs to really be in isolation, especially when you're experiencing fungal infection. Doctor, anything else that you want to highlight in your closure about fungal infection? Anything that a viewer should know of?
See, primarily, I would like to reiterate that treat when you have a fungal infection. Prevention is the primary thing. So take care of your hygiene, from clothing to whatever your immune health also. So diet also plays a major role. Stay healthy, basically. Second is, when you have a fungal infection, treat it properly. Don't wait, don't stop the treatment just because the symptoms have reduced. Complete the course of treatment and consult your dermatologist and start the treatment. Don't go to your the medical shop and take some treatments. I would want to specify one point, is that most of the fungal infections we do see where they go to the pharmacy and they give some medications and they start with it. So most of the time pharmacists are not aware what it is, and they end up giving some certain steroid based creams, which leads to resistance to our treatments, because steroids kind of increases the growth of the fungus, and that makes the treatment prolong further. So don't go to a pharmacist. Better is to consult a doctor and treat it properly, rather than delay the treatment and end up with more side effects as such.
Right, Doctor, absolutely. And I think just with this, there's another question, I'm sure, when we're talking about immunity. And there are people also who are taking home remedies. So I think Anushka has asked this question, that if there can be any home remedies also for fungal infection that people should really follow.
See, there is no home remedy per se, because once an infection has set in, it has to be treated. Unless and until we treat it to eliminate the fungus, it is not something where there is, just a skin change as such. It's an infection. Infection has to be treated. So there is no home remedies for an infection. So you have to treat the infection. There is no home remedies. Only your diet, hygiene are something that you can take care. But you have to treat a fungal infection.
Clearly. So, yes, immunity matters. Home remedies will not give you the permanent solution. You can probably take first hand help. I've seen people using coconut oil also, doctor, especially with the fungal infection coming in. I don't know if it leads to increasing that or something, but that's what I've read. And I firstly applied coconut oil also when I've got that redness and stuff coming in, and then going to the doctor. So I think these little tips would really help our people to understand what they should be doing when they see something like that happening and then going to the doctor. Doctor, there was another question that I personally had experienced when I was looking out for antifungal treatments. I was been put on medication for good 3 months, and then I had the infection recurring. That's when I felt that I don't know if medicines can really help me. So I also tried Ayurveda, where there was a process of blood extraction being done. and that blood extraction had to happen every month on month, around 180 to 200 ml of blood, wherein I actually lost a lot of my blood and hemoglobin count as well. So I don't know if such kind of treatments are available. Are they really effective or not? It didn't treat me completely, but it was extraction of impure blood. So I don't know if people who are experiencing something like this, should they really opt for something which is available in the market like this, or stick to medications?
See, I am not the right person to comment on Ayurveda, but still, I would want to say is that, see, the basic thing is that if you have an infection, so the infection has to be treated. So I don't know if it is an, so they, Ayurveda, they have a lot of things like impurities and other things. So when, when they're, withdrawing the blood, I don't know how they're, if even if they're withdrawing 500 ml of your blood, how, where is the remaining fungal infection going as such? It is, infection has to be treated with an, antifungal or certain medications. So until then, it is just a, something to boost your immune system is what they can give. But they, without an antifungal, I don't think the infection can be eliminated completely. It may delay your, I mean, it may help in improving your symptoms, but it is
Yeah.
not going to heal you completely.
Right. So I think fungal infections has bothered so many of us, and we've all been so worried of how to find the right treatment. But I think not losing hope and ensuring that you can get treated by following what the doctor tells you can really, really help. So my viewers, I hope you all have taken a lot of advantage of all the tips that we have given and the doctor has personally shared. Doctor, anything in the closure that you want to highlight before we really thank our viewers?
uh, I would like to conclude by saying that fungal infections are treatable. So consult the dermatologist at the earliest rather than delaying it. Earlier you treat it, the sooner you get a relief from it, and take a hygiene, the measures, clothes, and the moist environments you need to take care. All these, if you follow regularly, this is something which is completely treatable and nothing to be worried about. Because a lot of people go through this and they say, I'm suffering from it from years. That is only because you have not taken a proper treatment, you have not consulted the right dermatologist at a proper time as such. So if you take a proper treatment, definitely this is something which is a very easy thing that we can completely clear out.
Clearly, absolutely the right note, doctor, that we were looking for. It's clearly early treatment to early cure. So thank you very much, Dr. Deepa Krishnamurthy, for your valuable time and helping us with so much of information that you shared today. I'm sure all our viewers are going to benefit with all the tips that we've shared to ensure that they reach out to the doctors for the right treatment at the right time. Thank you very much once again, all viewers, for tuning in and for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, which is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you very much and have a great day, everybody.